Hello, good morning. First of all, I would like to thank the organizers for inviting me to this fantastic symposium. So I'm going to talk about a clinical application of high-intensity focused ultrasounds in neurological disorders. I'm a neurologist, so I'm on the translational part, so I am applying therapies that are already in the market. So the first neurological disorder where this technology was applied was tremor. Actually, it was applied to patients with essential tremor. An essential tremor is a particular type of tremor, different for Parkinsonian tremor or other types of tremor, where patients are not having tremor while they are in a resting position. But when they move their hands to make some action, they start to shake. So these patients have a lot of difficulties drinking, eating, writing, shaving, making up, etc., etc., etc. And depending upon the severity of the oscillation of the tremor, this can be very disturbing, and the quality of life of these patients is really damaged, because these are normal activities in daily living, as I said, eating, drinking, and sometimes they are not able to do it by themselves. So in this disease, patients were kind of orphaned, because the first treatment is based on drugs, and the issue is that many of these drugs are not very well tolerated. Many patients develop severe side effects, so they cannot be treated. And in other cases where they can tolerate drugs, the action is not that much. When the tremor is really severe, the reduction in tremor is not enough to have a normal activity. So the second-line therapies had been developed in decades ago that were deep brain stimulation. And I want to thank to my colleagues because they have introduced already the technique and also the physiopathology that allows the application of this technique. So as it has been said before, in the brain there are neurons that are discharging, that are working in an oscillatory way. So the neurons are not working in isolated manners, but they are organized, they have some patterns of discharge in oscillations, and this is related to health and to disease. So in essential tremor, these neurons are disturbing the whole motor circuit. And in one particular nuclei belonging to the motor circuit, that is the thalamus, these neurons are critical because they are concentrated in a small portion, and if we are able to suppress their activity or to eliminate them, we are going to be able to suppress the whole abnormal pattern of activity in the motor circuit, and the patients will be able to move their hands normally. So deep brain stimulation was developed with that objective, but as said before, it requires open surgery, so patients have the inherent risks such as brain hemorrhages, brain infections. There are also device-related side effects like cable breakage. There are also skin erosions, infections, and in addition, the patients need battery replacement. Now we have rechargeable batteries, but the patients sometimes have to go back to the neurologist to personalize the programmation, etc., etc. So although this technique is very successful controlling tremor, we have to have all this in mind, and we have also to consider that there are some limitations. For instance, age is a limitation, and some medical conditions are also limitations to be for many patients that cannot be treated with surgery. So this technology, high intensity focused ultrasound, is being a great advantage for these patients with tremor. And this is a technology that has the same principle, that is to eliminate this pattern of activity in the motor circuit, and it's going to be applied to the same nuclei where the electrodes were implanted. So it's done in the MRI. The procedure is performed in the MRI, and you can see here the MRI and a helmet, that is the helmet that is providing the high-intensity ultrasounds. So we identify the spot, the target, the nuclei where these neurons are located and where we want to focus the ultrasounds. So with the patient in the machine, in the MRI, we deliver more or less 1,000 of high-intensity ultrasounds to this particular point. So the temperature is going to increase, and the increment of temperature is proportional to the increment of energy. So this is the way we do that. So you have seen that the patient has a membrane before the helmet. This membrane is filled with cold water to prevent scalp lesions because of thermal erosions. And we then apply the helmet to provide the energy, to provide the ultrasounds. And this is an example of one patient with essential tremor, and you will see how the patient is not able to, oh, sorry, there were a video before. Oh. I don't know, the patient had to be before in another, sorry, there is no other. Okay, great. This is the patient. You can see that the patient is not able to sit up. The patient is not able to drink. The patient needs 2 hands, or sometimes practically it's impossible. The patient cannot write. So then the procedure is we have to shave the scalp. We implement this frame. We go to the MRI where we are going to put the membrane with ice water and then the helmet. And then the patient, oh, there was another video. I think it was, well, this is the final. There was the video where it was before. Yeah. So first of all, we have to shave the scalp. We put the frame in place, and then we go with the patient to the MRI. So we implement everything, all the stuff in the brain of in the head of the patient, and then we start to implement sonications. So we are increasing temperature gradually, and we can monitor in the spot where we are focusing the ultrasounds, we are monitoring the temperature. With this kind of temperatures, around 45, neurons are not able to have firing potentials. So neurons are going to stop, and we can check inside the machine, inside the MRI, that there is no tremor with different maneuvers that we know the patient have, for instance, drinking or wherever. Once we are sure that there is a benefit just hitting neurons, we raise the energy and we raise temperature to make a permanent lesion in that part of the brain. And this is the result. The result is seen in real life while the patient is in the MRI, and you can see that the patient just 2-3 hours after the treatment is able to write, is able to drink. So this is the technology that, as I said, was first applied to tremor, to essential tremor, and also to tremor in Parkinson's disease. But as mentioned before, there are other nuclei, such as the subthalamic nuclei, GPI, etc., whose pattern of activity, pattern of neuronal activity is completely abnormal, but different from the activity related to tremor. And that pattern of abnormal activity is linked to bradykinesia, rigidity, motility, dystonia, or wherever. So this treatment is being applied to all the nuclei in the brain where deep brain stimulation has been applied before, with similar results. Currently, there are also Parkinsonian patients treated with this technique in other nuclei, and are also clinical studies and clinical trials in dystonia and in other movement disorders. In addition, as said also before, this technique was applied, stimulation is applied for epilepsy, and also there are clinical studies in epilepsy, and also in the field of psychiatry. For depression, for obsessive-compulsive disorders, where deep brain stimulation was applied before, we are seeing the results of clinical trials with quite promising results. So this is a very new technique, is minimally invasive, is quickly done, and the results are monitored and seen in real time. And I think that in the future we are going to see this technique applied to many other neurological conditions, not only movement disorders, also epilepsy and maybe others, pain, and also psychiatric disorders, etc. Thank you.
Thank you.